Hi, this is Dr. Jamin Morrison from MD Anderson Cancer Center at Cooper. I'm a medical oncologist who specializes in the care of patients with gastrointestinal malignancies, including pancreatic cancer. We've already spoken a couple times about what is pancreatic cancer, how do we integrate a multidisciplinary approach to the management of these patients, and some newer therapies that are coming out or on the horizon. I want to talk a little bit about cancer genetics as it relates to pancreatic cancer, because it's a question I get very commonly. Did I get this from my parents? Could I have passed this along to my children? And I'm going to tell you what we currently understand, but I gotta say, our understanding of cancer genetics is rapidly evolving. As it currently stands, we think that about 10% of pancreatic cancers do have a hereditary component. That is to say, there may be something in the genetics of an individual, in about 10% of individuals with pancreatic cancer, that might have implications for family members. Even though that's a small number, we do recommend that every patient with pancreatic cancer meet with our genetic counselors and consider genetic testing. It might inform both how an individual's cancer is treated, but also it might have implications for their family members. The other question I get fairly commonly is about screening for pancreatic cancer. As we know, screening tests such as mammogram, colonoscopy, and low-dose CT scan can have major impacts on the diagnosis and on the prognosis of such cancers as breast cancer, colon cancer, and lung cancer. Unfortunately, the pancreas is a very difficult organ to access. It's also a difficult organ to get pictures of, to do imaging of. And in that way, we don't actually have regular recommendations for the general population with regard to screening. However, here at MD Anderson Cancer Center at Cooper, we do have one of the region's only pancreatic cancer screening programs, and it's targeted specifically to individuals who either have one of these genetic or hereditary variations. Those are individuals at a particularly high risk. It's also targeted at individuals who have a particular family history. So maybe many family members have been diagnosed with pancreatic cancer. In those instances, we use a combination of imaging and endoscopy or scope to evaluate the pancreas and actually screen for any sort of early stage abnormalities. With this, we are hopeful that we're able to identify pancreatic cancer at an earlier stage and hopefully impact outcomes. If you'd like to learn more, visit our website. Thank you for joining us.